Restless Leg Syndrome, or RLS, is a condition that affects millions of people, disrupting their sleep and daily lives. If you've ever felt an irresistible urge to move your legs, especially at night, you may be experiencing this condition. RLS can be frustrating, leading to restless nights, daytime fatigue, and even anxiety over sleep. In today's video, we're going to break down everything you need to know about Restless Leg Syndrome. We'll discuss what it is, how it's diagnosed, and most importantly, how it can be managed. If you or a loved one is struggling with RLS, you're not alone. There are ways to find relief. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Restless leg syndrome is a neurological disorder that causes an uncontrollable urge to move the legs. This sensation often occurs in the evening or at night when a person is sitting or lying down. People with RLS describe the feeling as a creeping, crawling, tingling, or aching sensation deep inside the legs. Moving the legs temporarily relieves the discomfort, but the symptoms often return once the movement stops. RLS is classified as both a sleep and a movement disorder. It's a sleep disorder because symptoms are worse at night and can make it difficult to fall or stay asleep. It's also considered a movement disorder because the involuntary urge to move the legs is a defining feature. However, RLS is ultimately a neurological condition, meaning it originates in the nervous system. This condition can affect anyone, but it's more common in middle-aged and older adults. Women tend to experience RLS more frequently than men, though the reason for this isn't entirely understood. It can also occur in children, though it is sometimes mistaken for growing pains or attention-related issues. The exact cause of RLS is not fully understood, but researchers believe that it is linked to dysfunction in the brain's dopamine system. Dopamine is a neurotransmitter that plays a crucial role in controlling muscle movement. If there is an imbalance in dopamine levels, it can lead to abnormal sensations and movements, like those seen in RLS. There are two main types of restless leg syndrome: primary RLS and secondary RLS. Primary RLS is idiopathic, meaning it has no clear cause. This type is often hereditary, meaning it can run in families. If a close family member has RLS, you may be more likely to develop it. Secondary RLS is associated with other medical conditions or factors. Some common causes of secondary RLS include iron deficiency, kidney disease, pregnancy, and certain medications. Iron plays a crucial role in dopamine production, and low iron levels can contribute to RLS symptoms. This is why iron deficiency anemia is one of the most common reversible causes of RLS. Chronic kidney disease can also lead to RLS because it affects iron levels and overall nerve function. Similarly, pregnancy, especially in the third trimester, can trigger RLS in some women. The good news is that pregnancy-related RLS often resolves after childbirth. Certain medications, including some antidepressants, antihistamines, and antipsychotics, can worsen or trigger RLS symptoms. If you suspect that a medication is contributing to your symptoms, it's important to talk to your doctor before making any changes. Diagnosing restless leg syndrome can be challenging because there is no specific test for it. Instead, doctors rely on a patient's description of symptoms and medical history. To diagnose RLS, a doctor will typically ask about the following. First, do you have an uncontrollable urge to move your legs, often accompanied by uncomfortable sensations? Second, are your symptoms worse in the evening or at night? Third, do your symptoms improve when you move your legs? Finally, do your symptoms occur when you are resting or inactive? If the answer to these questions suggests RLS, the doctor may order additional tests to rule out other conditions. Blood tests can check for iron deficiency and other potential causes. Sleep studies may be recommended if there is concern about other sleep disorders such as sleep apnea, which can sometimes mimic RLS symptoms. While restless leg syndrome is a chronic condition, there are many ways to manage it effectively. Treatment depends on the severity of symptoms and whether an underlying condition is contributing to RLS. For mild cases, lifestyle changes can be very effective. Establishing good sleep hygiene is crucial. This means maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and avoiding screens and bright lights before bed. Reducing caffeine, nicotine, and alcohol intake can also help, as these substances can worsen RLS symptoms. Regular exercise can improve symptoms, but it's important to find the right balance. Moderate activities like walking, swimming, or yoga can be beneficial, while intense workouts, especially late in the day, may make symptoms worse. Stretching before bed or practicing relaxation techniques such as meditation can also be helpful. If iron deficiency is contributing to RLS, iron supplements may be recommended. However, iron levels should be checked before starting supplementation, as too much iron can be harmful. For more persistent or severe cases, medications may be necessary. Dopamine agonists such as pramipexole and ropinirole are commonly prescribed for RLS. These medications work by increasing dopamine levels in the brain, helping to reduce symptoms. However, long-term use of dopamine agonists can sometimes lead to a phenomenon called augmentation, where symptoms worsen over time. Other medications, such as gabapentin and pregabalin, can be used for RLS, particularly if symptoms are painful. These drugs work by affecting nerve signals and can be especially helpful for people with neuropathic pain. In some cases, benzodiazepines like clonazepam or muscle relaxants may be used to improve sleep quality, though these medications are typically reserved for severe cases. If a medication is suspected to be worsening RLS, a doctor may adjust the prescription or try an alternative treatment. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics or questions you want covered in future videos. Anyway, beyond medications, alternative therapies may provide relief for some people. Massage therapy, acupuncture, and warm baths before bed can help relax the muscles and reduce symptoms. Some individuals find relief through the use of weighted blankets or compression sleeves designed for RLS. Restless leg syndrome is a lifelong condition for many people, but symptoms can often be managed with the right approach. For those with mild or intermittent symptoms, simple lifestyle changes may be enough to keep RLS under control. For those with more severe or persistent symptoms, a combination of lifestyle modifications and medical treatments can provide significant relief. If RLS symptoms are interfering with your sleep, daily activities, or mental well-being, it's important to seek medical help. Chronic sleep deprivation can lead to fatigue, difficulty concentrating, and an increased risk of other health problems. Additionally, if symptoms appear suddenly or worsen rapidly, an underlying condition such as iron deficiency or kidney disease may be the cause. Treating the underlying issue can sometimes resolve RLS symptoms entirely. If you have been struggling with restless leg syndrome and feel like nothing is working, don't give up hope. There are many treatment options available, and finding the right combination may take some time. Working with a doctor or a sleep specialist can help you develop a personalized plan to manage your symptoms effectively. So, restless leg syndrome may be frustrating, but it doesn't have to control your life. Understanding the causes, getting an accurate diagnosis, and exploring different management strategies can help you regain control of your sleep and well-being. Thank you for watching. As always, take care of yourself and make the most of your day.